Hello, and welcome to my Capstone and 5-year plan presentation. My name is Tomieka Johnson. I'm a registered nurse and taking class 4580 at Lamar University under Dr. Nancy McAfee, PhD, RN. I have my associate's degree in nursing since 2012. I spent 2 years on the postpartum unit, 2 years on the newborn nursery unit, and currently 2 years on the mother-baby nurse unit. I have certifications in BLS, NRP, ACLS, and as a breastfeeding counselor. I'm currently obtaining my baccalaureate in nursing degree. Prior to this, I was a cosmetologist since 1995 to 2012, and I currently maintain my license. I'm married for the past 22 years with 2 children, ages 15 and 18. I'm currently teaching childbirth, life with baby, infant CPR, breastfeeding, and proctoring our birth, baby, and beyond class. I absolutely love nursing and in the field of obstetrics. My first learning outcome is Humanity and Society Construct. Practices safe and effective holistic patient-centered care to a variety of patients and clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I feel like I met this learning outcome in the class 4321, Nursing Theories and Online Education. There I wrote a paper about Florence Nightingale and environmental theory, which I learned that environment encompasses everything that impacts the person's healing process. I also wrote an focus insight essay and question in this class on systems theory, Parsons' sick growth theory, Lewin's change theory, maturational change, and trans-theoretical model of behavior change. I feel like I also met this outcome in the class 4540, Care of Communities. There I did a service-based learning as disaster preparedness assignment, which enabled me to assist my community aggregate to prepare more effectively for a disaster while becoming a source of information and skills for my community. I felt like I met Humanity and Society Construct 96%. My second and third learning outcome under Lifespan Health Continuum. Learning outcome number 2 supports patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. I felt like I learned this in the class 4316, Comprehensive Holistic Health Assessment, in the Shadow Health Assessment, which assesses and evaluates patients with different health problems. In the class 4540, Care of Communities, I did a community-based service learning, which identified a program for palliative and hospice care. I discussed how to become a member of this program to support civic pride and diversity. I felt like I met learning outcome number 2, objective 99%. Learning outcome number 3 evaluates patient-centered care for patient client across the lifespan based on common and complex health needs and compromise multiple determinants of health. I learned this in class 4620, Care of Patients with Compromised Multiple Health States. There I did a practical reflections where I interviewed a person with diabetes and located resources to help her. In nurse class 4580, Synthesis of Professional Nursing, I also learned about Lewis Blackman's story, which taught me that patient-family perspective of lessons learned from a tragic outcome. I felt like I met learning outcome number 3, objective 99%. Evidence-based practice, clinical reasoning construct, outcome number 4, synthesizes clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. I felt like I met this outcome in class 4390, nursing inquiry and evidence-based practice. I wrote a critique of quantitative research paper, which I critique of stress and coping of critical care. I also learned this objective in class 4321, Nursing Theories and Online Education, with the DEC paper, which compared patient safety between an ADN nurse versus a BSN nurse. I felt like I met outcome number 4 objective 97%. Outcome number 5, patient-client-centered care construct, which employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intraprofessional healthcare team. I felt like I learned this objective with Class 4316 in Comprehensive Holistic Health Assessment using the Shadow Health Assessment and discussion question. In the Shadow Health Assessment, we assessed a patient with injured diabetic, child with asthma, abdominal pain, and chest pain. I also learned this objective in Class 4620, care for the patient with compromised multiple health states. There, we did reflections 1 through 4, speaking with a patient with left hemisphere stroke while using the book My Stroke of Insight for comparison and contrast. My patient that I interviewed also had left hemisphere stroke. I learned a lot during this reflection. I also felt like I met the objective in Class 4550, Nursing Practice Leadership and Management in Healthcare System, where we did a practical assignment in clinical practice using a global health PowerPoint, which talked about safety precautions while using blood thinners. I felt like I met this objective patient client-centered care construct 99%. Outcome number 6 and 7 under professional roles construct. Learning outcome number 6, differentiate multiple dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients, as a member of the interprofessional healthcare team. I felt like I met this objective in Class 4550, Nursing Practice Leadership and Management in the Healthcare System. Effective Leadership and Qualities paper is what I wrote, which discussed my leadership style and goals for the care and safety of the patient, and compared an effective leader versus an ineffective one. Also, 4321, Nursing Theories in Online Education, with the DEC paper, which compared and contrast the ADN nurse with the BSN nurse. I felt like I met this objective 98%. The learning outcome number 7 demonstrates professional integrity, effective communication, active energy, and service to community. I felt like I met this objective in Class 4580, Synthesis of Professional Nursing, with the Windshield Survey, to determine how a disaster would impact the daily activities and healthcare need of community aggregate. My community aggregate was 65-year-old plus disabled people living alone. I also met this objective with Class 4540, Care of Communities. There, I learned the story of baby William, which identifies system interventions to prevent adverse outcomes and promote patient safety. I felt like I met this objective 98%. My 5-year plan. Well, 2018 was to complete the baccalaureate program for nursing at Lamar University. I am about to meet this outcome by December. Year 2019, learn the role of co-charge on the mother-baby unit at my facility. In the year 2020, I want to obtain a certified as a mother-baby nurse. A certification as a mother-baby nurse, rather. In the year 2021, I want to become a nurse educator full-time. In the year 2022, I want to go back to school to obtain my master's degree in nursing. Thank you.